Thank you, Mr Deputy Speaker. I rise this afternoon to give my contribution on the report back of the Premier across a number of his portfolio areas, particularly with matters that were raised in the session around the Macquarie Point Stadium, the AFL, around health. What I want to do first, though, is reflect on the extraordinary contribution that we just heard from the independent member from Lyons, Mr Tucker. And in doing so, I ask myself the question, how does anyone allow anything to get to this point? How does somebody, the Premier of Tasmania, allow himself, his government, the members of his team to get to the point where they come into this chamber time on time again, they attend committees, estimate committees time on time again, and prevent themselves internally from being able to tell the truth, from being able to respond to simple questions with simple answers? What was the moment in life that said, it's all okay, we don't actually have to act in the best interest of Tasmania, we don't actually have to respond to questions that are asked, we don't actually have to be honest about the state of things and the mess that we're in, we'll just pretend and hope that it all goes away and we'll just continue to do what we've always done, say nothing to see here, we'll kick the can down the road, maybe in August it'll all be better. But the extraordinary contribution of Mr Tucker, where he reflected on the excuses of this government, the excuses of this Premier to hide behind cabinet incompetence, to pretend that there is an internal division and to pretend that they are not silencing members of their own team around their concerns, particularly around the stadium development, but not just the stadium development. I remember someone referring to this project as the pin-up boy of the lack, or the pin-up project of the lack of transparency and accountability and competence of this government, but it just is a reflection of so many other projects and behaviours of this government. Mr Tucker suggested that the cracks are opening up. Well, I think the Tasmanian people can see that the cracks are wide open, and implored, as he did on the moment that he decided that he could no longer be a member of this government, and implored this Premier to start listening. That is what I have heard in the 2 years that I've been here, that not only his own members, not people from the opposition, from the crossbench, from communities, from his own communities in Braddon, saying, start listening. And if you start listening and you start taking a deep breath and a step back and saying, okay, it's not too late, I can actually say, how do I clean up where I'm at? Then actually things will start to settle down and Tasmanians will start to be served, because that's why we're here. We're here to service the people of Tasmania. I want to focus on one of the Premier's highest responsibilities, and that is that he's chosen for himself to not only just be the Premier of Tasmania, but to be the Health Minister of Tasmania. And I want to focus on my own electorate of Bass and focus on the concerns that were disclosed throughout the Estimates Committee's hearing about the inaction of this government to progress the master planning development of the LGH. My understanding is from calculations done through the estimates scrutiny that it took 9 times to ask the Premier whether he had actually sought federal government funding for the Stage 2 development of the LGH, and only after 9 times you ask a question. And I say again, how does it get to the point where someone thinks it's okay that someone asks a question we're not going to answer? Maybe they just won't ask me again, maybe I'm okay. But that it takes 9 times to admit that, no, I actually haven't been to Canberra or picked up the phone and asked for federal funding for the LGH. How is it that it's so easy to go to Canberra and ask for funding for a stadium, but not for a signature piece of a previous election commitment to deliver essential health infrastructure for the people of Tasmania, for the people of northern Tasmania, for members of our community that are so unwell and not able to get services, that waiting lists and ambulance ramping time and bed block numbers are appalling, and in some cases lead the country in the poor state of service and delivery, that you can't actually do what you say you would do and seek funding for that project. Time on time, just today, but not just today, every day, weeks and months, this government repeat that Tasmanian Labor are anti-development. Well, I'll tell you, if the government's looking for a development that will create critical outcomes for Tasmanians, develop jobs for Tasmanians, and in the Deputy Speaker's own electorate of Bass, create outcomes that will increase the health and wellness, productivity and contributions of families, of children, of grandparents, then how about you deliver on your promises for the Stage 2 redevelopment of the LGH? It requires federal funding. You've acknowledged that it requires federal funding. It is now on you to take action to ensure that you can deliver that project, because we have people that are sharing stories with us. We've just heard stories about Tasmanians that are waiting for critical surgeries, that are waiting for critical appointments to see specialists, to actually have be treated with the dignity and respect that they require to have the basics of health services. And that can't be done unless this Premier, who's chosen to be the Health Minister, actually completely and fully does his job and prioritises what's important to Tasmanians, not tries to dig his heels in and close his ears and close his eyes to the reality of what's happening in Tasmania about the community in Tasmania saying that building a stadium isn't a priority, delivering health services is a priority for people in our community. In the report back from the estimates, I've spoken about ramping. There were some extraordinary figures revealed in the estimates where for ambulance ramping, across Tasmania, in the 4 major hospitals, there were 31,528 hours of ambulances being ramped in Tasmania. Now, that was from July 2022 to March 2023, and when you unpack that number, that's roughly the equivalent of 5 ambulances being ramped 24/7 over that 9-month period. Now, that's extraordinary. Within this budget and following the scrutiny, what we needed to see was a government and a minister, a premier, focused on the right priorities and seeking to actually address this issue, because it's a damning reflection of the state of Tasmania's health service, and it's an absolute signal to the fact that this government doesn't have their priorities right. What we know in Tasmania, that many people live in rural and regional districts, and we know that the rural and regional hospitals are being underutilised and therefore not fully servicing their local communities, and in doing so are putting extra pressure on the major hospitals in the city centres. And we know that if those regional and rural hospitals were fully utilised, then pressure and costings would be taken out of, say, the Launceston General Hospital and the Royal Hobart Hospital. Yet again, this government, this Premier, the Health Minister, has been unable to indicate through budget estimates his priority commitments for health services in Tasmania. The other point through the health feedback from that estimates session was around staff shortages, around nurses. We know that many of the incredible people that work in the Tasmanian health system are feeling broken. They are being required to work so many extra hours. They are covering double shifts. There are an incredible pressure on people to continue to work, although they may not feel up to it, putting themselves and others at risk. And all of our Tasmanian Health Service employees want nothing other to support Tasmanians to live a healthy, productive and engaged life. But with the pressures that they're feeling because this government doesn't have their priorities wrong, they're unable to do that fully. And that is stressful, and it's unfair to the people in our health services. Our nurses, who play a pivotal role, require and deserve support. They deserve more support with more nurse practitioners, more clinical nurse educators. They deserve support for the well-being and the wellness of them undertaking the most basic of services that they want to do in getting up each and every day to deliver health services in our hospitals. When you have members of this government who leave the government because they can no longer believe that they can be heard, can make a contribution to turn a ship around that is on the course for disaster, and that they have to leave and go to the crossbenches, and then from the crossbenches signal to the rest of Tasmanians that that's not just it, that there are others expressing and reflecting their concerns and not being able to be heard, coming out of this estimate session from the Premier of Tasmania, who in that session continued to hide it's
Honourable
not.
Premier.